there is an important keyword to check if you or someone around you might have had a stroke. That keyword is face, arms, speech, time. F stands for face, meaning you check for facial paralysis. Ask the person to smile and see if one side of their face droops or looks uneven. Thank you for watching this video. This is YouTube Medical University. Today, I'd like to share the story of Mr. S, who is in his 60s and recently visited my clinic. For the past few weeks, he had been feeling a bit off. He came to my clinic because he was having trouble gripping things with his right hand. At first, he thought it might just be due to age or fatigue, so he didn't worry about it. But one morning, when he tried to type on his computer as usual, his fingers wouldn't move the way he wanted, and he started making more typing mistakes. Then, when he tried to pick up a teacup, he couldn't grip it properly and ended up dropping it. At that moment, he suddenly thought something might be wrong and rushed to see a doctor. After some tests, we found that Mr. S had a small cerebral infarction. Fortunately, because it was discovered early, he is living without any major after effects. However, it's actually quite common for subtle signs of a stroke to first appear in the hands like this. Mr. S said that when he thinks about what might have happened if he had ignored that strange feeling in his hand, it gives him chills. In fact, this kind of experience might not be something that only happens to other people. It's said that about 1 in 4 Japanese people will have a stroke, such as a cerebral hemorrhage or cerebral infarction, in the future. And here's a very important point I'd like to share today. Just like Mr. S, it's not uncommon for people to notice something unusual before they actually have a stroke. In other words, it's extremely important not to overlook these warning signs that appear in your body and to see a doctor if you notice them. There is something called the golden time for cerebral infarction. When blood flow is cut off due to a cerebral infarction, brain cells begin to die off rapidly. Once brain cells have died, they cannot recover. That's why, in order to minimize brain damage, it's necessary to see a doctor as soon as possible and receive treatment such as dissolving the blood clot or removing it. You might think it's just fatigue or due to aging. That's right, it's easy to ignore minor physical discomfort. However, among those symptoms you ignore, there could be the progression of a serious condition hidden underneath. If you watch today's video until the end, you'll understand what a cerebral infarction is and why signs appear in your hands. I'll introduce 5 patterns of changes in the hands that could indicate a possible cerebral infarction. I'll also explain what you should do if you notice any abnormalities. And ideally, rather than waiting to get a cerebral infarction and then treating it, you'd want to prevent it before it happens. In the so-called pre-disease stage, I'll carefully select and rank drinks and foods that are good to consume for preventing cerebral infarction, so please watch until the end. At YouTube Medical University, from the perspective of doctors who actually examine and diagnose cerebral infarctions, we provide important information that can help you become healthier starting tomorrow, as well as advice on how to avoid getting sick in the first place. We share information about preventive medicine. We would be truly happy if you could subscribe to our channel so you don't miss any new videos. So here is today's agenda. First, in the first part, I'll briefly explain what kind of illness a cerebral infarction is and why signs appear in your hands in the first place. In the second part, I'll introduce 5 hand signs of cerebral infarction that you shouldn't overlook if you're concerned. In the third part, I'll explain from the perspective of an active doctor where you should go if you notice such symptoms, how you should get to the hospital, and which department you should visit. And finally, as you've been waiting for, it's best not to get sick in the first place, isn't it? I'll introduce important drinks and foods to help prevent cerebral infarction all at once. This will be a long video, but I think it's worth saving. Please listen to it as many times as you like, and feel free to use the comment section like a memo to add important points. I think this will help you remember the information better. So first, in the first part, let's talk about what kind of illness cerebral infarction actually is. I'll explain it simply. In short, cerebral infarction it's when a blood vessel in the brain gets blocked, causing brain cells to die and resulting in damage. The brain sends all kinds of commands to the body, right? So you might experience things like numbness in your hands, difficulty moving your legs, or trouble speaking. Various impairments can occur. Brain cells are extremely delicate, and if blood flow stops for just a few minutes, they die and become necrotic. The area of the brain that gets damaged depends on where the blood vessel is blocked. Because the function of the affected part of the brain declines, you might have trouble speaking, numbness in your hands and feet, or numbness in your face. This leads to a variety of symptoms. While it's more common in elderly people whose arteriosclerosis has progressed with age, there are definitely people in their 40s, 50s, or even younger who can have a stroke or cerebral infarction. So why is that? Why do signs appear in the hands? Well, our hands can move with great precision, right? It's said that what makes humans unique is our ability to use tools, and the nerves in our hands are controlled by a fairly large area of the brain. For example, when we want to hold a pen, a command is sent from a specific part of the brain called the motor cortex, and that command travels instantly through the nerves like a highway to our hands, allowing us to move them. Conversely, if we touch something hot, the sensory receptors in our hands recognize the heat, and that information also travels through the nerves to the brain, which then tells us to pull our hand away or cool it down. Our hands are so sensitive that we can even feel a little bit of sand on them, whereas it's harder to notice sand on our back or stomach. Because of this sensitivity, it's common for symptoms or warning signs of a cerebral infarction or its precursors to appear as changes in the hands. And when people ask if there are any warning signs or precursors to a cerebral infarction, the answer is actually yes. It's called transient ischemic attack or transient ischemic attack. To put it simply, without fear of misunderstanding, it's like the beginning stage of a cerebral infarction. In general health magazines, it's sometimes called a mini stroke or a warning attack. In other words, temporarily, a blood vessel in the brain gets blocked, causing symptoms like numbness in the hand or difficulty speaking. Symptoms do appear, but it's said that they usually last only a short time, from a few minutes to within an hour. After a little while, you might think, my hand felt numb, but what was that? And the symptoms completely improve. Because the symptoms go away, people tend to think it was just their imagination or become optimistic, thinking that, oh, it got better on its own. But this is dangerous. People who experience this transient ischemic attack have an extremely high risk of having a stroke afterward. In other words, this is a yellow warning sign that a stroke might happen soon. For people who have these symptoms, the guidelines basically say that they should be hospitalized and receive treatment to thin their blood, or undergo detailed tests to see how easily their blood vessels might become blocked. So, since there can be warning signs before a stroke, please listen to the 5 hand signs of stroke that I will introduce in the next section. If you think that your symptoms at that time might have been related, you should consider seeing a neurosurgeon or a similar specialist. Also, after watching this video, if you notice any of these symptoms, please make sure to suspect the possibility of a stroke or its warning signs. Doing so can increase your chances of avoiding future disabilities or after effects caused by a stroke. Please listen until the end. Now in the next section, I will introduce the 5 dangerous hand signs of stroke that you will regret not knowing. 5 dangerous hand signs of stroke. The first one is being unable to write letters properly, or your writing becomes messy. This is easy to imagine, isn't it? When you have a stroke, you may experience paralysis of the motor nerves in your hand, which means it becomes difficult to move or apply strength. Have you ever felt like your hand shakes more than before when you hold a pen, or that you can't draw straight lines and your writing becomes unbalanced? Even if you try to write neatly, your letters end up looking wobbly, like worms. Some people might wonder if it's just because they haven't written much lately. Please don't just dismiss it as being caused by presbyopia. In fact, writing characters requires very fine control of your fingertips and adjustment of strength. It's actually a task that mobilizes various functions of the brain. It's not just the areas that control movement or sensation in the hands. There's also a small part of the brain called the cerebellum, located at the back of the brain, and when this area is affected, you can also experience difficulty moving your hands or similar signs. So not only is it important if your hands can't move, are hard to move, or have trouble gripping, but also if you become less skilled at fine tasks. That's a very important sign as well. For example, you might find it harder to button your shirt or zip up a zipper. It's common to struggle with these kinds of fine tasks as well. In the case of a stroke, blood flow is blocked on one side of the brain, so symptoms appear on one side of the body. If you have trouble writing or doing fine tasks on just one side, always suspect a stroke or its warning signs. The second of the 5 dangerous hand signs of stroke you should know about is this: numbness or loss of sensation when you touch something. For example, even if you touch something with your fingertips, it becomes hard to tell whether it's smooth or rough. Or you might touch something hot and not feel the heat, but then notice your hand is burned. Or you might feel something strange in your hand even though nothing is actually touching it. Do you ever feel a dull sensation like you're wearing a thin glove on your hand? This could be a sign that your sensory nerves are being affected by a stroke. This is called sensory dullness. The scary thing about this sign is that there's usually no weakness or pain, so many patients tend to ignore it. Sometimes when a patient tells me, "Doctor, my hand feels numb," and I ask when it started, they say it's been about a month. I have to tell them, please come in sooner next time. While you might think it's nothing serious, the condition could actually be getting worse. There's also the story of Mr. S that I mentioned at the beginning, so it's important to pay attention not only to whether the symptoms are bothering you, but also if they're only appearing on one side, if the numbness is gradually spreading, or if the numbness is getting stronger. If you notice these kinds of changes, please be especially careful. If you don't know about this, you might regret it later. The third of the 5 warning signs of stroke in the hand is this. Your hand trembles unintentionally. Do you ever experience your hand shaking without you meaning to? The most common type of hand tremor is the cause is called essential tremor, and with essential tremor, there isn't a specific cause. Many people experience hand tremors due to various factors like genetics. However, hand tremors can also occur with a stroke. For example, when you try to hold a cup, your hand shakes, or when you try to write, your hand trembles and you can't write well. Of course, these kinds of hand tremors can be caused by things other than stroke, like essential tremor or Parkinson's disease, but they can also be a sign of stroke. As I keep saying, if the symptoms appear only on one side, start suddenly, or keep getting worse, you need to be very careful whether it's a stroke or not. Please make sure to consider seeing a doctor. The next of the 5 warning signs of stroke in the hand is having trouble grabbing things or dropping things more easily. How about you? Have you also found yourself dropping things more often, or accidentally dropping your smartphone? Has anything like that happened to you? I think this is something that can happen to anyone, but please pay extra attention to symptoms that are easy to dismiss as just being careless, because they can happen to anyone. If you've been watching my videos, you might already expect this, but as I keep saying, with a stroke, the motor nerves in your hand are affected, making it hard to grip things. Even if you think you're holding something tightly, you might not actually be, and things can slip out of your hand and fall. That's the reason. I think it's easier to understand and apply if you consider the reasons behind these symptoms. For example, you might wonder if this symptom could be caused by a stroke because you can't grip things tightly, or maybe you got burned because your sense of touch is dull. If you remember the reasons, you're less likely to get the wrong information or panic. That's why, here at YouTube Medical University, I always try to explain the reasons behind things. Also, another cause of dropping things easily is not just weakness, but also numbness or dull sensation in your hand. Even if you have strength, if your sense of touch is dull, you're more likely to drop things. For example, you might find it harder to pick up food with chopsticks. These kinds of fine hand movements are difficult to do well if your sense of touch is dull. Because of this, you might accidentally drop things like a remote control or a teacup, even though you still have strength in your hand. If you feel like something is off, please check the sensation on both sides of your hands. Try touching a newspaper or a plastic bag and see if there's any difference between your left and right hands. If you notice any difference, I think it's important to pay close attention to it. The 5th and final dangerous hand sign of a stroke is a change in the temperature of your hand. This isn't about your sense of touch becoming dull. Sometimes you might experience an abnormal sensation in your hand. Even though your hand isn't actually cold, it might feel extremely cold. Or even though your hand isn't hot, it might feel like it's burning or extremely hot. These strange symptoms can sometimes occur. If you notice a clear difference in how your left and right hands feel temperature, please be careful. This often happens due to problems in the sensory area of the brain or in the thalamus, which is an important area where nerves pass through. It's like a glitch in the brain's sensory system. What's important is when you feel cold, even though it's not actually cold, or you feel hot, even though it's not actually hot. If it really is cold, there might be another cause. And if it's really hot, it could be a disease related to metabolism that raises your body temperature. So please remember that it's about an abnormal way of sensing things. Don't just assume it's simply poor circulation or menopause. Actually have someone else touch your hand and check the temperature. I think that's also important. So how was it? Let's review what we've covered so far. As a dangerous sign in the hand that could be overlooked and led to disaster in the case of a stroke, the first is having difficulty writing characters or buttoning buttons. Having trouble with fine motor tasks. Second, numbness in the hand. Third, developing hand tremors. Fourth, becoming more likely to drop things. And fifth, experiencing symptoms where your hand feels abnormally hot or cold. These are the symptoms I introduced. Here at YouTube Medical University, we provide information that can help you become healthier starting tomorrow and also discuss what you can do to avoid getting sick in the first place. We share information from the perspective of a practicing doctor. I think it's important to have at least one reliable source of information, so if you found this helpful, I would really appreciate it if you subscribe to the channel. Now, in the third period, I'll talk about something very important from a doctor's perspective. What should you do if you suspect something? I'll explain what actions you should take and what things you should check. Also, if you actually go to the hospital, I'll briefly introduce what kind of treatment you can expect so you can be prepared. First, if you notice something unusual, what should you do? The answer is, consider seeing a doctor immediately. As I mentioned at the beginning, a stroke is a race against time. If you feel something is wrong, go to the hospital right away. Don't spend time searching for information or don't think, I'll wait until the next morning. Even if it's at night, I believe you should consider seeing a doctor. Some important signs I mentioned in the second part are that the symptoms appear suddenly, they appear only on one side, and multiple symptoms occur together. These all increase the possibility of a stroke. For example, you might have weakness and numbness at the same time. Also, even if the symptoms disappear, if you had stroke-like symptoms that went away, that could be a transient ischemic attack, commonly known as a mini-stroke. You should not ignore this either. Actually, if there is an unstable blood clot in your neck, it can keep breaking off and almost block the brain, and the next clot that breaks off could cause a stroke, so please be very careful. Also, if you or someone around you might be having a stroke, there is an important keyword to help you check. That keyword is face, arms, speech, time. Face, arms, speech, time is an acronym using the first letters of each word. F stands for face, A stands for arm, S stands for speed, and T stands for time. F is for face, meaning you check if there is any facial paralysis. Ask the person to smile and check if one side of their face is drooping or looks uneven. A is for arm, which refers to the arm symptoms I mentioned earlier. Have the person raise both arms horizontally and check if one arm drifts downward. S is for speech. Check if their speech is slurred or if they sound like they're drunk. And T is for time. If you notice the time when the symptoms started, make a note of it. Call an ambulance right away and tell them when the symptoms began. The treatment options will change depending on how much time has passed. Please review the face, arms, speech, time steps as many times as you need. Please leave a note in the comments section. Outputting your thoughts as a comment will help you remember better. When you actually visit the hospital, what kind of tests will be done? They will perform tests like a computed tomography scan or magnetic resonance imaging to determine whether it's a cerebral infarction or a cerebral hemorrhage. Simply put, both tests involve lying on your back and passing through a large ring-shaped machine. These tests are done to check for bleeding or blockages in the brain's blood vessels. If it seems to be a cerebral infarction and not much time has passed, if it's within the golden time, they may administer medication to dissolve the blood clot or use catheter treatment to retrieve and remove the clot. After that, to prevent recurrence, you may be prescribed 2 types of blood-thinning medication for a certain period. And in the first place, they will check for things like high blood pressure, diabetes, and cholesterol, which can cause cerebral infarction. And if any of these are untreated, they will make sure to treat them properly. The goal is to control arteriosclerosis to prevent recurrence. And unfortunately, if paralysis remains, rehabilitation will be carried out to improve the after effects as much as possible. For those who don't want to have a cerebral infarction or want to lower their risk, I've posted videos about high blood pressure, diabetes, and cholesterol in the description, so please check them out if you're interested. This is a review of the 3rd period. If you think you might have a cerebral infarction, be sure to consider seeing a doctor. Don't just put it off until tomorrow or dismiss it as aging. Make sure to check your symptoms. Remember to check your symptoms using the 4 face, arms, speech, time points. F is for face. Can you move your facial muscles and make an E expression? A is for arm. Can you put strength in your arm? S is for speech. Is your speech clear? T is for time. Remember exactly when the symptoms started and be sure to tell someone. Please remember these 4 points. Now thank you for waiting. Ideally, you want to avoid the risk before you even have to go to the hospital or have a stroke, right? To prevent cerebral infarction, what kinds of foods and drinks should you consume? I will introduce scientifically proven options, carefully selected and ranked, so please listen closely. Now, let's get right into it. In this 4th section, I'll introduce foods and drinks you should avoid if you want to prevent cerebral infarction. Here are the top 6 worst drinks that cause arteriosclerosis. Number 6 is water-based juices. What are water-based juices? They are drinks like these. When you go to a convenience store, you see drinks that look just like water in clear, healthy-looking bottles, but they taste like peach or white grape. They're sold as if they're just water with a peach flavor, and they're easy to drink, so you can drink a lot of them. But if you think about it, they're actually quite sweet. In fact, patients who come to my clinic often say, it's healthy because it's just water with flavoring, right? But please take a close look at the ingredient label. When I checked the ingredient label of a certain peach-flavored water, I found out that it contained as much as 26 grams of sugar. That's about 6 to 7 cubes of white sugar. Did you realize there's more sugar dissolved in it than you expected? So even if you're working hard to diet through your meals, if you drink water-based juice thinking it's healthy because it's water, you might actually be taking in unexpected calories from your drinks and not losing weight as easily. Of course, there are 0-calorie water-based juices, so at least try switching to those, or just switch to plain water. Please consider making these changes. Make sure you don't get fooled by these watery juices. They can cause arteriosclerosis. The 6th worst drink, and in 5th place, are drinks with sweeteners. Earlier, I said that 0-calorie flavored water might be okay, but actually you need to be careful with artificial sweeteners too. Why artificial sweeteners? You might think they're fine because they're 0 calories, and in that sense that's true, but artificial sweeteners themselves require caution. This is a study published in 2017 targeting men over the age of 45. It reported that those who consumed carbonated drinks with artificial sweeteners had about 2 to 3 times higher risk of stroke compared to those who did not consume them. Furthermore, the study also showed that even the risk of dementia increased. Isn't that surprising? Things like diet this and that. You know how there are 0-calorie diet versions instead of regular carbonated sodas? Actually, those kinds of drinks might also increase the risk of stroke. The artificial sweeteners included in the previous study were things like saccharin, aspartame, and sucralose. These artificial sweeteners are actually several hundred times sweeter than sugar. On top of that, since they have no calories at all, they are quite popular. However, recent studies suggest that these artificial sweeteners might actually have negative effects on health. In studies focusing on saccharin, which is an artificial sweetener, although these were only animal experiments so the reliability is low, there have been results showing an increase in bladder cancer. It's still not clear for humans. In addition, there are concerns that artificial sweeteners might disrupt the gut environment. There are also concerns that artificial sweeteners might reduce insulin secretion, which is needed to lower blood sugar levels, and that the long-term effects on health have not been fully studied yet. I can't say that you should absolutely avoid them altogether. However, if you consume these artificial sweeteners and notice that your health is getting worse, or if you actually start gaining weight, or if you feel any kind of change, I think you should be cautious. Now here is the 4th worst drink that can cause arteriosclerosis. Energy drinks. Energy drinks. I'm sure many of you rely on them sometimes. To be honest, I also used to drink energy drinks when I was a student, or when I had to stay up all night during night shifts, especially when I was really sleepy. However, maybe it's just my constitution, but if I drink too many energy drinks, I start to feel palpitations, so I try to only drink them when I'm really exhausted. Actually, if you think about it, those energy drinks are pretty sweet, aren't they? A typical energy drink contains about 27 grams of sugar per 250 milliliters. That's equivalent to sugar cubes. That's about 6 to 7 sugar cubes, right? According to a study from Toronto University, the sugar contained in energy drinks, it's caffeine. There are research reports suggesting that people who have genes that metabolize caffeine slowly are more likely to develop high blood pressure if they consume too much caffeine from things like energy drinks. Some of you might be wondering how much energy drinks or caffeine you can safely consume, but actually, there isn't a recommended intake amount that says you should take up to this much. There is, however, an upper limit set to help prevent negative health effects, but depending on Looking at reports from different countries, caffeine is often defined as about 300 to 400 milligrams per day. The amount of caffeine in energy drinks varies, but I think that even at most, 1 can per day is probably an acceptable amount. By the way, a can of black coffee contains about 100 milligrams of caffeine per can. So if you drink up to the daily caffeine limit, just 3 cans of black coffee would already reach 300 milligrams, so please be careful. Also, caffeine itself can worsen symptoms, or its safety is not guaranteed for children, pregnant women, women who are pregnant, people with cardiovascular diseases, heart conditions, or mental health issues. In 2001, the World Health Organization stated that when pregnant women consume caffeine, it can lead to the safety of the fetus is not guaranteed. In other words, it may have some effect on the fetus. So, to go back to the topic, you need to be careful with the caffeine in energy drinks. And since they are sweet, you should also be careful not to drink too much. I have a fellow doctor who has made it a habit to drink energy drinks, and he drinks 2 cans every day. Please take this as a cautionary tale. Only drink them when you really need to, and limit yourself to 1 can a day. If you have any underlying health conditions, please consult your primary doctor before deciding whether to drink them. Now moving on to the top 6 worst drinks that can cause arteriosclerosis. Number 3 is fruit juice. We've talked about this several times at YouTube Medical University. Many people think fruit juice is healthy because it's made from fruit. However, many fruit juices have added sugar to make them sweeter. And even though sold as 100% juice may have sugar added during the concentration and reconstitution process, also the sugar naturally found in fruit It's called fructose, and it's even sweeter than sucrose, which is the main component of regular sugar. That's why fructose is used in all kinds of soft drinks. However, the fructose found in fruit. There is data showing that fructose, the sugar found in fruit, can raise cholesterol levels. It's been reported that consuming 20 grams of fructose per day can increase total cholesterol levels. Furthermore, if you consume 100 grams of fructose per day, not only does your total cholesterol go up, but your bad cholesterol also increases. The same results were found in studies conducted on Japanese people. So it's not true that the sugar in fruit is always good for your health, and you should be careful not to consume too much of any kind of sugar. The same goes for vegetable juice. The vegetable juice you all drink is actually quite sweet, isn't it? Some of them contain almost the same amount of sugar as regular juice. Please check the nutrition label on the back and look at the calories. I recommend eating real food as it is, whether it's fruit or vegetables. In the process of making juice, important nutrients like vitamins can be lost or destroyed. Dietary fiber is also removed. Of course, if you really love orange juice and want to drink it, I'm not going to stop you. I also drink juice sometimes. Enjoying these things occasionally for pleasure is actually a good thing, but just avoiding choosing such juices without really wanting them can lower your future risk of things like stroke. So please consider switching your daily drinks to ones with no calories, drinks that cause arteriosclerosis. The second worst is alcohol. Let me say this first. I also drink alcohol, but when I was a college student, I started drinking more and more, and there were even times when alcohol made me sick. Because of these experiences, I started researching alcohol quite a lot. As the saying goes, alcohol is considered the best of all medicines, but there are indeed studies suggesting that drinking alcohol in low amounts may reduce the risk of ischemic heart disease, which is a condition where the heart's blood vessels get blocked. However, according to the latest medical research, that might actually be a research error, and there are also studies showing different results. So, the current common belief is that alcohol, no matter how little, poses a health risk. And people often say that drinking in moderation is okay, but figuring out what moderation actually means is difficult. When you drink alcohol, your muscles relax and you start to feel good, and before you know it, you lose self-control and end up drinking too much. Because of that. That's why I'm introducing alcohol as the second item. So does alcohol itself actually have the effect of increasing cholesterol? When we drink alcohol, the place where it's metabolized is the liver. The liver metabolizes alcohol, and in that process, something called triglycerides are produced. When these triglycerides are synthesized, it results in an increase in low-density lipoprotein cholesterol, which is known as bad cholesterol, and a decrease in high-density lipoprotein cholesterol, which is known as good cholesterol. So not only should you be careful about drinking too much alcohol, but drinking itself can raise your cholesterol and increase your risk of stroke in the future. There is a possibility. According to the Ministry of Health, Labor and Welfare's guidelines, the appropriate amount of alcohol is said to be 20 grams per day for men and 10 grams per day for women. 20 grams of alcohol is about 1 500 milliliter bottle of beer, 1 serving of sake, or about 1.5 glasses of wine per day. It's not just about cholesterol. Alcohol itself can also damage your liver. There is also data showing that it increases the risk of cancers such as esophageal cancer and stomach cancer. The social loss caused by alcohol amounts to 6.6 trillion yen per year. That's how much it's said to be. So, for those of you who drink alcohol, please reconsider your habits. However, I'm not saying that drinking alcohol is an absolute evil. You don't live just for your health, right? If you lose your happiness for the sake of health, it defeats the purpose. It's important to maintain a good relationship with alcohol. Enjoy it in moderation, adjust the amount you drink, and have days when you don't drink at all. I hope this is helpful, and I will also be careful myself. Now, the number one most dangerous drink that causes arteriosclerosis is soft drinks. I think most of you already know this, right? I'll explain just how bad they are, including some data. People who habitually drink soft drinks increase their risk of heart attacks and strokes. In a study conducted at 10 locations nationwide, targeting about 39,000 men and women aged 40 to 59 women who answered that they drank soft drinks every day had a 21% higher risk of stroke over an 18-year follow-up period compared to women who said they never drank them. Among strokes, the risk of cerebral infarction, which is a disease where the blood vessels become blocked rather than ruptured, increased by about 83%. Simply put, it was about twice as high. Men also had an increased risk of stroke, but the increase was more pronounced in women. As for what kinds of beverages were considered soft drinks in this study, This includes carbonated beverages and other soft drinks, flavored juices, and the fruit juices we mentioned earlier. While it's probably fine to enjoy these occasionally, making a habit of drinking soft drinks could be something that brings you closer to a future stroke. Let's review what we've covered so far. We've talked about water-based juices, artificial sweeteners, energy drinks, fruit juices, alcohol, and soft drinks. If all of these are bad for you, then what should you drink instead? Are there any beverages I can recommend? So, let me introduce the top 4 drinks that help keep your blood vessels healthy and may prevent strokes. Drinks that might help prevent strokes. Number 4 is red wine. I just said earlier that alcohol is bad for you, but I still ranked red wine at number 4. There's a reason for this. Red wine contains... It's said that a component called polyphenols may help prevent future strokes. Polyphenols are natural substances that plants produce to protect themselves from ultraviolet rays and other threats. They're found in things like red wine and green tea. Since it's a nutrient that's been getting a lot of attention lately, I think many of you have probably heard of it. It's also found in coffee and other things. Recent studies have reported that polyphenols may help reduce the risk of stroke. Why might polyphenols have the potential to lower the risk of stroke? Let me explain a bit, though it might get a little technical. A stroke is a condition where a blood vessel in the brain gets blocked, leading to insufficient blood flow and causing brain cells to die. When blood flow is disrupted, nerve cells, a substance called glutamate is released. When glutamate is released, I'll skip the details, the concentration of calcium inside the nerve cells increases. As a result, something called nitric oxide is produced, and this ends up killing the nerve cells. According to research from a Japanese university, to put it simply, polyphenols are thought to suppress the mechanism that causes cerebral infarction, and that's why they chose red wine. The reason is, are you familiar with the Mediterranean diet? It's based on fruits, fish, olive oil, and nuts that are found along the Mediterranean coast, in places like Italy and other parts of coastal Europe, and small amounts of dairy products and red wine. Combining these foods is called the Mediterranean diet. This diet is attracting attention because it's said to lower the risk of certain cancers, reduce the risk of future arteriosclerosis, heart attacks, and cerebral infarctions, and even possibly lower the risk of dementia. Red wine, which is also included in this diet, is, in my opinion, one of the effective choices for those who really want to drink alcohol. Of course, be careful not to drink too much. Now, the third drink that may help prevent cerebral infarction is salt-free beverages. Salt-free beverages. That might sound a bit roundabout, but to put it simply, recently there's been a trend of drinks containing salt being promoted as a way to prevent heat stroke. These kinds of drinks are becoming more common. Some sports drinks are like that too. Actually, it's said that this salt can also increase the risk of stroke. If you think of salt and immediately think of blood pressure, you're right, but there are many reports showing that the more salt you consume, the higher your risk of stroke. In a study involving 170,000 people, according to a highly reliable paper, a meta-analysis that gathered 13 studies, just an increase of 5 grams of salt intake per day raised the future risk of stroke by 23%. 5 grams is about the amount in one bowl of ramen. Just a difference of one day like this can change your future risk of stroke by 20%. So, drinks sold in stores like Salty Something or Other, or those marketed for heat stroke prevention, while they may indeed help prevent heat stroke, they are important for hydration. But if you're not doing any particularly sweaty work and you're not dehydrated, drinking those just because they taste good might only increase your future risk of stroke. By the way, those drinks called Salty Something or Other, I checked one of them and it had about 0.5 grams of salt per 500 milliliters. In addition, Ischemic kelp tea. It's delicious, isn't it? I like it too. But if you think about it, it's actually a bit salty, isn't it? Ischemic kelp tea contains about 1 gram of salt per cup. That's actually quite a lot. Sports drinks also contain about 0.5 to 1 gram of salt per 500 milliliters, so please be careful. The World Health Organization recommends that adults consume less than 5 grams of salt per day. So just by drinking sports drinks or Ischemic kelp tea, you're already consuming 1/5 of your daily salt intake just from drinks. And what I really want you to pay more attention to is, Japanese people drink miso soup, right? This miso soup. If you drink 3 cups a day and each cup contains about 1 gram of salt, that's 3 grams. That means you can only get 2 more grams of salt from your meals. With that in mind, when I give salt intake guidance to hypertensive patients in my clinic, I sometimes suggest avoiding miso soup and switching to warm tea or just hot water instead. Japanese people are already said to consume a lot of salt. At the very least, try to avoid getting it from drinks. I think aiming for 0 grams is important when it comes to reducing salt intake. Here are the top 4 drinks to prevent stroke. Second place goes to coffee. As I mentioned earlier when talking about polyphenols, coffee is a drink that has evidence-based data showing it can help prevent stroke on its own. In a study by the National Cancer Center, which followed 80,000 men and women for 13 years, those who drank 2 or more cups of coffee a day, or about 3 to 6 cups a week, had a 13% to 22% lower risk of stroke compared to those who didn't drink coffee. And that's not all. Not only did it lower the risk of stroke, but it also reduced the risk of heart diseases caused by clogged arteries. Isn't that surprising? Earlier, I mentioned that you should be careful with the caffeine in coffee, but now the polyphenols found in coffee itself are attracting attention for possibly helping to prevent strokes. According to research from a Japanese university, men who drink coffee regularly, compared to those who don't drink it at all, there are reports that show a significant decrease in small vessel diseases in the brain, such as bleeding in the brain's small blood vessels, small strokes, microinfarctions, or microbleeds among those men. But that's not all. Some components found in coffee are also used in the treatment of strokes. It's believed that coffee may enhance the activity of a substance called alteplase, which is used to dissolve blood clots. This substance is actually produced by our own bodies. If the activity of alteplase, the substance that dissolves blood clots, is low, it's believed that blood clots can form more easily, increasing the risk of stroke. From this perspective as well, coffee is expected to help prevent strokes because it makes the blood flow more smoothly and increases the activity of substances that dissolve blood clots. I think it's easier to understand when you consider the reasons behind it. On the other hand, you need to be careful not to consume too much caffeine, so it's best to limit coffee to about 1 or 2 cups a day. Also, depending on your underlying health conditions, please consult with your primary doctor about how much coffee is appropriate for you. Now, the number 1 drink that may help prevent strokes is water. I think many of you probably expected this. After all, it's best not to take in unnecessary calories, and water, which contains no salt or sugar, is the simplest and most recommended option. There's a term called watershed infarction, which refers to a condition that can occur when a person collapses or becomes severely dehydrated. This is a type of stroke where the brain cells die or the blood vessels become narrowed. In other words, what I want to say is that dehydration can also cause a stroke. The risk of stroke and heart attack increases with a lack of fluids. When you become dehydrated, your blood gradually thickens and becomes more likely to clot, so please keep that image in mind. Thinking about it this way, you can understand just how important staying hydrated is. In fact, in Japan, not only do cases of heat stroke increase, but the number of stroke patients also rises. Many people think that blood vessel blockages are more likely to happen during the cold winter months, but actually, you also need to be careful about dehydration. Of course, you can also hydrate yourself with drinks other than water, but please be careful with coffee and alcohol, and green tea and similar drinks have a diuretic effect. So even if you drink these, you'll end up losing the fluids through urine, so you should consider them as neither adding nor subtracting from your hydration. Barley tea is a great way to hydrate and get minerals other than water. There are also caffeine-free barley teas available, so please give them a try. As a guideline, it's said that you should drink about 2 liters of fluids a day, but since meals also contain a lot of water, I think it's enough if you can drink about 1 liter of fluids a day. Of course, if you're sweating a lot outdoors in the middle of summer, that's a different story and you'll need to drink even more, so please be careful. Let's review what we've covered so far. Recommended drinks for preventing cerebral infarction. As the top 4, in 4th place is red wine, which contains polyphenols, and in 3rd place are drinks that do not contain salt. In 2nd place was coffee, and in 1st place I introduced water. Now, in the final 3rd period, there are not only drinks but also many recommended foods to help prevent cerebral infarction. For example, the fat found in red meats like beef and pork is called saturated fat, and it actually raises cholesterol levels. So what should you eat instead? What should you use instead of the salad oil you usually use? And besides that, I'll clearly explain whether there are diets that can help prevent cerebral infarction. Recommended foods for preventing cerebral infarction. Here is the 5th place, olive oil. The oil found in salad oil is called saturated fat. Low-density lipoprotein cholesterol, also known as bad cholesterol, increases. However, the oil contained in olive oil is an unsaturated fat, which actually helps lower cholesterol, making it a very good oil. Among olive oils, extra virgin olive oil is expected to reduce the risk of clogged blood vessels in the future. Actually, olive oil is oil extracted from olives, but depending on the manufacturing method, it is largely divided into 2 types. The first is virgin olive oil and the second is refined olive oil. What is the difference? The first one, virgin olive oil, is what you might call 100% juice, oil extracted by simply crushing olives as they are, and the second one, refined olive oil, is oil that has been chemically processed to adjust its components and color, refining the aroma and flavor after being directly extracted by pressing olives like the first virgin olive oil. Olive oil that has been refined is called refined olive oil. Of these two, the one I recommend is the first one, virgin olive oil, which is simply pressed as it is. Furthermore, among virgin olive oils, those with a low level of acidity and high quality are called extra virgin olive oil, and it is said that these may help reduce the risk of future strokes or heart attacks. In fact, by consuming 4 tablespoons or 60 milliliters of this extra virgin olive oil per day, there are even studies showing that the risk of stroke and heart attack was reduced by as much as 30%. The oleic acid contained in this extra virgin olive oil is expected to reduce low-density lipoprotein cholesterol and actually increase good cholesterol. And that's not all. This extra virgin olive oil is also said to contain polyphenols, which I mentioned when talking about red wine. These components are believed to prevent the aging of blood vessels and may help lower the risk of future strokes, so I highly recommend it. When buying olive oil at the store, please consider choosing extra virgin olive oil whenever possible. Personally, I often use this olive oil as a salad dressing, dip my bread in it instead of spreading butter, or use plenty of it when making seafood marinades. It has a wonderful aroma, and there's also the added benefit that drinking it might help lower your cholesterol, so I really recommend giving it a try. Foods recommended for stroke prevention. Number 4 on the list is fish. At YouTube Medical University, we might have mentioned this so many times that you're tired of hearing it. I've explained that eating fish is good for preventing heart attacks, but actually, it also helps lower the risk of stroke. Fish is recommended. The reason is because of the eicosapentaenoic acid and docosahexaenoic acid found especially in blue-backed fish. These are also oils that belong to the group of unsaturated fatty acids, which I mentioned earlier when talking about olive oil. They are also called omega-3 fatty acids. There has been a lot of research on these omega-3 fatty acids, so I'll briefly introduce what effects they have. They lower triglycerides, reduce low-density lipoprotein cholesterol, which is bad cholesterol, and increase high-density lipoprotein cholesterol, which is good cholesterol. And amazingly, they also help lower blood pressure. They also help calm your heart rate a bit, and recent studies have even reported that taking these omega-3 fatty acids alongside standard treatments for depression has led to better treatment outcomes. In the past, people used to say that fish oil is good for your brain and makes you smarter, but there's actually no data showing it makes you smarter. However, since it has so many different benefits, after all, it's always better to include fish in your diet. There is data showing that eating fish more than 4 times a week lowers the risk of acute coronary syndrome, which is a disease where the blood vessels in the heart get blocked. And the more fish you eat, the lower the risk becomes. So even just changing 1 day a week from eating meat to eating fish should help lower your risk of developing blood vessel blockages in the future. For recommended fish, eating blue-backed fish like mackerel, Pacific sorry and sardines makes it easier to get omega-3 fatty acids. If you want to learn more about eicosapentaenoic acid and docosahexaenoic acid, I've made a video about it in the past, so please check the description after this. The third recommended food for preventing cerebral infarction is green leafy vegetables. People often think that eating vegetables is just generally good for your health, but green leafy vegetables may actually help reduce the risk of cerebral infarction. Green leafy vegetables like spinach, komatsuna, and kale contain nutrients that help lower the risk of cerebral infarction. One of these is a substance called nitrate. When you eat these vegetables, the nitrate in your body is converted into nitric oxide. The chemical formula for nitric oxide is nitric oxide, and this substance is expected to help dilate blood vessels, improve blood flow, and lower blood pressure. So by eating green leafy vegetables, your blood vessels can become more flexible, and it is believed that your future risk of cerebral infarction may also decrease. In a study conducted in 2021, the group that consumed at least 60 milligrams of vegetable-derived nitrate per day, mainly from green and yellow vegetables, which is about the amount in one plate, had about a 17% lower risk of cerebral infarction compared to the group that did not. Not only that, but eating vegetables itself can help lower blood pressure and cholesterol. And what's more, it's expected to have various effects such as reducing the risk of cancers like stomach cancer. To prevent cerebral infarction, it's especially important to eat green leafy vegetables like spinach, komatsuna, and kale. Please make a conscious effort to include these kinds of vegetables in your diet. The way I actually eat them is by making ohitashi, which reduces their volume so you can eat a lot at once. Spinach is also fine to put in miso soup. I also recommend stir-frying them or having them as a smoothie. Please try to find a way of eating them that suits you. What are some ways you all are incorporating them? If you have any ways of eating them, please let me know in the comments section. The second recommended food for preventing cerebral infarction is nuts. Anyway, nuts have been recommended many times here at YouTube Medical University. I've said many times to replace your usual snacks with small packs of nuts. This is also important for preventing cerebral infarction. Nuts help lower the risk of your blood vessels getting clogged in the future. This is a study involving about 47,000 Japanese men and women. It looked at the amount of food they consumed and its related factors. They investigated the future risk of stroke and heart disease. As a result, the group that ate the most nuts had, compared to the group that ate the least, the risk of cerebral infarction was reduced by as much as 20%. Why does just eating nuts help prevent cerebral infarction? As with previous findings, the oil in nuts is unsaturated fatty acid. But that's not all. Nuts contain unsaturated fatty acids, which help lower bad cholesterol, low-density lipoprotein cholesterol, and raise good cholesterol. Nuts themselves are also rich in vitamins and minerals. The vitamin E in nuts has antioxidant properties and is thought to be important for keeping blood vessels youthful. Minerals like potassium and magnesium help lower blood pressure. Because of these factors, it's believed that nuts improve blood flow and lower blood pressure, which in turn reduces the risk of cerebral infarction. And that's not all. Another benefit of eating nuts is dietary fiber. It's possible that this dietary fiber helps regulate the gut environment and suppresses the absorption of cholesterol. It may also serve as food for gut bacteria and helps improve bowel movements. So please, instead of eating sweets when you feel a little hungry, try eating nuts. Actually, their texture and aroma are enjoyable and they're quite satisfying, so even a small amount can keep you full for a long time. And walnuts, cashew nuts, almonds, hazelnuts, there are many kinds of nuts, so if you rotate them, you won't get bored. Please give it a try. One thing to be careful about is nuts that are fried in oil, or there are also many nuts with added salt, but these often contain a lot of oil or can lead to excessive salt intake. If possible, I recommend eating nuts that are not fried in oil and have no added salt. Foods recommended for preventing cerebral infarction. The last of the top 5, number 1, is high cacao chocolate. I chose this as number 1 partly because it's unexpected. Chocolate. On its own, chocolate is a sweet that contains a lot of sugar and should be consumed with caution, but high cacao chocolate, which contains a lot of cacao, has a type of polyphenol called flavonol. These flavonols are found in cacao, and in the future, it's said that they may help reduce the risk of clogged blood vessels. If you're hoping for health benefits, I recommend choosing chocolate with a cacao content of at least 60 to 70%. Some products claim to be dark chocolate or high cacao, but actually only contain about 30% cacao, so please make sure to check the ingredient label and choose products that contain at least 60 to 70% cacao, the cacao in these chocolates. What's so good about flavonols? Actually, nitric oxide is involved here as well. These flavonols help promote the production of nitric oxide in the body. As I mentioned earlier, nitric oxide helps dilate blood vessels and lower blood pressure. That's the effect it has. Several studies have reported that eating high cacao chocolate more than 3 times a week can lower blood pressure and reduce the risk of heart vessel blockage by 9%. And because these flavonols help dilate blood vessels, it's now expected that they may also be good for maintaining cognitive function by increasing blood flow to the brain. In addition, there are suggestions that they may lower low-density lipoprotein cholesterol and raise good high-density lipoprotein cholesterol. There are also such reports. Of course, depending on the product, some chocolates contain quite a bit of sugar and are high in calories. Please try to choose chocolate with a higher cacao content. However, if you suddenly eat something with a very high cacao percentage, like 90%, and you're not used to it, you might be surprised. At first I also wondered why it was so bitter, but I was told to just keep eating it and see, so I gradually ate more and my taste buds got used to it. Eventually, I was able to enjoy the aroma of cacao itself. Since it's bitter at first, please eat it little by little. If you do that, you'll start to notice a subtle cacao aroma spreading and even a slight sweetness that you can enjoy. Also, the bitterness contained in cacao itself is expected to help reduce your appetite. We humans are basically programmed at the genetic level not to eat too much of foods that taste bitter, because bitter foods often contain toxins and could be dangerous. So, to help control your appetite and keep your blood vessels young, I encourage you to consciously try eating this high cacao chocolate. How was that? Number 5 is extra virgin olive oil. Number 4 is fish oil, especially eicosapentaenoic acid and docosahexaenoic acid. Number 3 was green leafy vegetables like spinach, kale and komatsuna. And then number 2 was nuts. And finally, number 1 was high cacao chocolate. I'm not saying you have to eat all of these right away, but as you think about your diet, if you feel like you could incorporate some of these, or if you already eat them in a certain way, please share your thoughts in the comments. I think it will be helpful for others. And finally, a quick tip from me. While diet is important, lifestyle habits are actually important too. If you spend a lot of time sitting during the day, just the fact that you sit for long periods can actually lead to poor blood circulation and increase your risk of stroke. Japanese people are known worldwide for spending long hours sitting, so when you're doing desk work or working from home, if possible, try to stand up once every hour and do some stretching or exercises to promote blood circulation, even if you don't do exercises or stretches. It's fine to just take a break once an hour to go get some water, drink it, and then come back. Recently, some people have started using standing desks and working while standing. I hope you'll take a look at your own lifestyle habits and try to increase your physical activity as well as pay attention to your diet so you can reduce your risk of stroke in the future. How was this video? It was a long one, but thank you for listening until the end. Please take notes or listen to it multiple times to review. By watching this video, I think you can greatly lower your risk of stroke in the future and increase your chances of noticing early signs and getting treatment sooner. If there was anything surprising or if you have things you pay attention to in your diet, please feel free to share them in the comments. I'd really appreciate it. Even just a quick note like high cacao chocolate is fine, so please share. I'm looking forward to hearing from you, and I'd appreciate it if you could rate this video, whether it's a thumbs up or a thumbs down. Well then, see you in the next video. This has been How to Live Without Aging After Your 70s, as taught to me by my patients in general medicine. A bestseller in 4 categories on Amazon and also ranked in the gift rankings. It reached number 1. I've compiled into one book the important ways of living and health tips that I've learned from my patients while working as a doctor. It's a book that will make you think, I want to live a healthy life like this too. It's on sale now and getting great reviews, so please check it out.